Right now, while you're watching this video, your liver may be doing something that your doctor has never once mentioned to you. Not because they're hiding it, not because it's rare, but because what I'm about to explain happens silently, without pain, without warning, and without a single symptom, until the damage is already deep enough to be serious. Here's the truth most people with high blood sugar are never told. Your blood sugar problem is not just a pancreas problem. It is not just an insulin problem. It is a liver problem. And until you understand what your liver is doing when your blood sugar is out of control, every medication, every diet change, every supplement you try is working against a system you don't fully understand. I've spent over 2 decades in clinical medicine. I've reviewed thousands of metabolic cases, and one pattern keeps appearing in patients who cannot get their blood sugar under control no matter what they do. They have never been given a complete picture of what is actually happening inside their body. That changes today. By the time this video ends, you will understand exactly what your liver does when blood sugar runs high, why it starts making things dramatically worse, what the warning signs look like on your labs, and most importantly, what you can do to reverse the process before the damage becomes irreversible. Stay with me, because the mechanism I'm about to explain is the missing piece that no one has shown you yet. I've spent more than 20 years working with patients managing metabolic disease, high blood sugar, insulin resistance, fatty liver, type 2 diabetes. I've seen what happens when these conditions are managed only with medication and never fully explained. And I'm going to be honest with you about something. The way blood sugar is typically managed in most clinical settings is incomplete. Patients are told to reduce carbohydrates, take their metformin, check their numbers, and come back in 3 months. And when the numbers don't improve, the dose goes up. Then another medication gets added. But nobody sits down and explains what the liver is doing during all of this. Nobody draws the map. That's what this video is, a map, a complete explanation of the liver-blood sugar connection that your doctor either doesn't have time to explain or was never trained to explain in detail. I'm not going to give you vague advice. I'm going to show you the mechanism, the actual biological process, and then I'm going to give you concrete, actionable steps based on peer-reviewed research. Not theory, not trends. Science. Let me tell you what's actually happening in the body of the average senior with uncontrolled blood sugar. Because I want you to understand the stakes clearly before we go any further. When blood sugar runs high, chronically, persistently, day after day, your body does not simply let the excess glucose float harmlessly in your bloodstream. Your body, designed for survival, tries to do something with it. And the organ that bears the greatest burden of that process is your liver. Here's what most people don't realize. Your liver is not just a filter. It is the master regulator of your blood sugar. It is the organ that decides, every single hour of every single day, how much glucose is in your blood. Not your pancreas, not your medications, your liver. When the system is working properly, your liver holds glucose in reserve, stored as glycogen, and releases it slowly, steadily, as your body needs it. It's a beautifully balanced process. You eat, insulin rises, your liver absorbs glucose. You fast, insulin drops, your liver releases glucose. Balance, stability, normal blood sugar. But here's what happens when that system breaks down. When blood sugar has been running high for months or years, which describes the situation for tens of millions of seniors right now, your liver cells become overwhelmed with glucose. They've been absorbing excess sugar for so long, they stop responding normally to insulin signals. This is called hepatic insulin resistance, and it is, without question, one of the most dangerous and most overlooked drivers of blood sugar chaos in older adults. When your liver becomes insulin resistant, it does something catastrophic. It starts releasing glucose into the bloodstream, even when blood sugar is already high. even when your body doesn't need it, even when you haven't eaten in hours. Think about that for a moment. Your liver, the organ that's supposed to regulate your blood sugar, starts adding fuel to a fire that's already burning out of control. This is why so many seniors wake up with high fasting blood sugar despite not eating anything overnight. It's called hepatic glucose output, and when it's dysregulated, when the liver is resistant to insulin's signal to stop, it doesn't matter how carefully you eat during the day, your liver is adding glucose to your blood at night while you sleep without your permission. This is also why medication alone so often fails. Metformin, for instance, works primarily by reducing hepatic glucose output. But if the underlying cause of that excess output, the insulin resistance in the liver itself, is never addressed, the medication is fighting a battle that keeps getting harder to win. Now I want you to do something for me. Comment below right now with your fasting blood sugar number. Just the number. I want to see what people are waking up with. And add the word morning so I know it's your fasting reading. Because the pattern I'm about to describe, the liver's role in driving up fasting glucose, is something most people have never connected to their own numbers. And I want to see how many people watching this video are dealing with exactly what I'm describing. Let's go deeper. Because once you understand the full mechanism of what the liver does when blood sugar is out of control, everything else I'm going to tell you will make complete sense. There are 5 things that happen inside the liver when blood sugar is chronically elevated. Every single one of them makes the situation worse, and they all feed into each other in a cycle that, if left unchecked, can progress from high blood sugar to fatty liver disease, to liver inflammation, to fibrosis, and in the worst cases, to cirrhosis, which is irreversible scarring of the liver. Let me walk you through each one. First, the liver converts excess glucose into fat. When there is more glucose arriving at the liver than the liver can store as glycogen, the liver does not simply discard it, it converts it. Through a process called de novo lipogenesis, which simply means creating new fat from scratch, the liver takes that excess glucose and converts it into fat molecules called triglycerides. Those triglycerides are then packaged and either sent into the bloodstream, which raises your triglyceride levels on your lab work, or stored directly inside the liver cells themselves. When fat begins accumulating inside liver cells, this is the beginning of non-alcoholic fatty liver disease, or NAFLD. And this is critical to understand. You do not have to drink a single drop of alcohol for your liver to become fatty. Excess blood sugar and insulin resistance do the same damage. According to data published in the journal Hepatology, non-alcoholic fatty liver disease affects approximately 25% of the global population, and the rates are significantly higher in people with type 2 diabetes and prediabetes. Many of those people have no idea their liver is affected because there are often no symptoms in the early stages. Second, a fatty liver becomes insulin resistant, which makes blood sugar worse. Here's where the cycle becomes truly vicious. Once fat accumulates in liver cells, those cells become less sensitive to insulin. They stop responding properly to insulin's signal to stop releasing glucose. This is the feedback loop that traps so many patients. High blood sugar drives fat into the liver. The fat in the liver causes insulin resistance. The insulin resistance causes the liver to dump more glucose into the blood, which raises blood sugar further, which drives more fat into the liver, around and around. A landmark study published in Cell Metabolism demonstrated this connection clearly, showing that hepatic fat accumulation directly impairs the liver's insulin signaling pathways, creating a self-reinforcing cycle of worsening metabolic dysfunction. Third, the liver ramps up glucose production overnight. This is the phenomenon I introduced earlier, hepatic glucose output. But I want to explain the mechanism more precisely so you can see exactly what's happening. Your liver stores glucose in a form called glycogen. Under normal circumstances, when you haven't eaten for several hours, your liver breaks down that glycogen and releases glucose to maintain your blood sugar between meals. This is called glycogenolysis, and it's completely normal and healthy. But your liver can also manufacture brand new glucose from non-sugar materials, from amino acids, from lactate, from glycerol. This process is called gluconeogenesis, and in a healthy liver, insulin suppresses this process when blood sugar is already adequate. In an insulin-resistant liver, a liver that has stopped responding properly to insulin, this suppression doesn't work. Gluconeogenesis runs unchecked. The liver keeps manufacturing new glucose and releasing it into the blood, particularly in the early morning hours, because the hormonal environment overnight is conducive to glucose production. This is the biological explanation for the dawn phenomenon, that frustrating pattern where fasting blood sugar in the morning is higher than it was when you went to bed. Fourth, liver inflammation compounds the damage throughout the body. When liver cells become engorged with fat, they become stressed and inflamed. They release inflammatory signaling molecules called cytokines into the bloodstream. These cytokines travel throughout the body and worsen insulin resistance in muscle tissue, in fat tissue, and in other organs. This is why uncontrolled blood sugar and fatty liver disease are not isolated problems. The inflammation produced by a stressed, fatty liver makes insulin resistance a whole body condition, not just a liver condition. Research published in the journal Diabetes Care has shown that markers of liver inflammation, particularly elevated ALT and AST, enzymes that your doctor checks on a standard metabolic panel, are independently associated with worsening insulin resistance and cardiovascular risk. If your liver enzymes are even mildly elevated, this is a signal worth taking seriously. Fifth, the liver's ability to process medications declines. This is a point that rarely gets discussed. As the liver becomes fatty and inflamed, its capacity to metabolize medications, including blood sugar medications, decreases. Drug clearance slows. Dosing that was calculated for a healthy liver may become excessive or insufficient for a compromised one. For seniors who are often managing multiple medications simultaneously, this is particularly relevant. A liver under metabolic stress handles pharmacology differently than a healthy liver. This is one of the reasons that some patients on blood sugar medications find their response becoming erratic, not because the medication has stopped working, but because the liver processing it has changed. Now here's what I need you to do. Comment below with just 2 things: your age and whether your doctor has ever mentioned your liver in connection with your blood sugar. Comment like this: 68, never mentioned. I want to see how many people have been managing blood sugar for years with no one connecting these dots. Now, before I move into what you can actually do about all of this, the concrete, evidence-based steps to start breaking this cycle, I want to mention something briefly. Everything I've just explained, the de novo lipogenesis, the hepatic insulin resistance, the dawn phenomenon, the inflammation cycle, this is the foundation. But foundation knowledge alone doesn't change blood sugar numbers. You need a system. You need a daily roadmap that takes this science and translates it into what you eat, when you eat, how you move, and how you track your progress. That's exactly why our team of doctors put together something called the Blood Sugar Toolkit. And for a brief moment, Dr. Roy will tell you about this toolkit. Over to you, Dr. Roy.
Thank you, Dr. Michelle. The Blood Sugar Toolkit is a comprehensive digital resource, an ebook and PDF guide that contains everything you need to implement what you have learned in this video. It includes a full blood sugar guide that explains the why in clear language, including doctor communication scripts so you can actually advocate for yourself at your next appointment. It includes a cookbook with 40 low glycemic recipes using the plate method. Visual, simple, no complex calorie counting. It includes a guide on herbal teas, cinnamon, ginger, hibiscus, that have genuine research behind their role in supporting healthy blood sugar levels and how you can prepare these simple teas. And it includes a complete 30-day blood sugar reduction program, daily plans, tracking tools, and senior-safe movement guidance. The link is in the description below and pinned in the first comment. Dr. Michelle will mention it again at the end, but I wanted you to know it exists now, because as you go through the solutions section, you're going to want a place to take all of this and put it into practice immediately. If you are a senior who is passionate about your blood sugar health, then you should click the link in the description to check out this toolkit. Now, I will let Dr. Michelle take the stage again. Thank you.
Thank you, Dr. Roy. Now, let's talk about what actually reverses this process. There are 6 evidence-based interventions that directly address hepatic insulin resistance and break the liver blood sugar cycle. I'm going to walk through each one precisely, with the mechanism, the research, and the specific action. Step 1. Eliminate liquid fructose entirely. This is the single fastest way to reduce the fat accumulation inside your liver cells. Here's why. Fructose, the sugar found in fruit juice, sweetened drinks, high fructose corn syrup, and many processed foods, is metabolized almost exclusively by the liver. Unlike glucose, which is distributed to muscles, brain, and other tissues, fructose goes directly to the liver. And when it arrives in excess, the liver has no choice but to convert it to fat through de novo lipogenesis. A study published in JAMA showed that just 8 weeks of restricting added sugar, particularly fructose, to less than 3% of daily calories, produced significant, measurable improvements in liver fat in adolescent participants. Adult and senior studies have replicated this direction. The practical action? Eliminate juice, sweetened beverages, and any processed food with high fructose corn syrup on the ingredient label. This is not about eliminating fruit. Whole fruit consumed with its fiber behaves very differently than concentrated fruit juice. The fiber slows fructose absorption and reduces the liver load. The juice strips that fiber away. Step 2. Eat protein at your first meal. This is one of the most underutilized tools in blood sugar management for seniors. When your first meal of the day is high in protein rather than high in carbohydrates, several things happen simultaneously. First, protein stimulates much less insulin release than carbohydrates, keeping your insulin environment calmer throughout the morning. Second, protein triggers a hormonal signal of satiety that carbohydrates do not, meaning you eat less throughout the rest of the day. Third, protein helps preserve muscle mass, and skeletal muscle is one of the primary tissues responsible for absorbing glucose out of the bloodstream. Research published in the journal Obesity, studying over 9,000 adults, found that people who consumed higher protein at their first meal showed markedly different food choices and lower caloric intake for the rest of the day. And critically for seniors, protecting muscle mass is not optional. It is fundamental to glucose metabolism. Target 25 to 35 grams of protein at your first meal. Eggs, Greek yogurt with no added sugar, cottage cheese, smoked fish, all excellent options. Step 3. Implement a consistent eating window. This does not have to be aggressive fasting, but it does have to be consistent. When your liver and pancreas are given a genuine rest from insulin stimulation, a period of several hours with no food intake, insulin levels drop. And when insulin levels drop consistently, hepatic insulin resistance begins to improve. Your liver, no longer bombarded with continuous insulin signaling that it has stopped responding to, begins to recalibrate its sensitivity. A 2019 study published in Cell Metabolism showed that time-restricted eating within a consistent 8 to 10-hour window without changing diet composition, led to meaningful improvements in fasting glucose, insulin levels, and blood pressure in metabolic syndrome patients. For seniors, This does not mean skipping meals aggressively. It means having your first meal at a consistent time and finishing eating at least 3 hours before bed. That 3-hour cutoff before sleep is particularly important because, as we discussed, the liver ramps up glucose production overnight, and eating close to bedtime extends the insulin stimulation period into those critical nighttime hours. Step 4. Add specific foods that directly support liver function. 3 foods deserve particular attention here based on their documented effects on hepatic fat and liver enzyme levels. The first is cruciferous vegetables: broccoli, cauliflower, Brussels sprouts, cabbage. These contain a compound called sulforaphane, which activates detoxification pathways in the liver and has been shown in animal and early human studies to reduce hepatic fat accumulation. 2 to 3 servings per week is a meaningful target. Extra virgin olive oil, not just a healthy fat in general terms, but specifically liver protective. A randomized controlled trial published in Nutrition and Metabolism showed that olive oil consumption was associated with reduced liver enzyme levels and improved insulin sensitivity compared to other fat sources. The polyphenols in high-quality extra virgin olive oil, particularly oleocanthal, appear to reduce hepatic inflammation directly. Coffee. This one surprises people, but the evidence is substantial. Multiple meta-analyses have found that regular coffee consumption, including decaffeinated coffee, is associated with significantly lower rates of non-alcoholic fatty liver disease progression and lower liver enzyme levels. The mechanism appears to involve coffee's polyphenols reducing oxidative stress and inflammation in liver tissue. 2 to 3 cups per day appears to be the range showing the most consistent benefit in the literature. Step 5. Move after meals. This is not about exercise in the traditional sense. This is about one of the most powerful, underused glucose management tools available to every senior, regardless of fitness level. When you walk, even for 10 minutes, immediately after eating, your active muscles absorb glucose directly from the bloodstream through a mechanism that does not require insulin. The mechanical act of muscle contraction opens glucose transporters in muscle cell membranes independently of insulin signaling. This process is mediated by a pathway called AMPK activation. What this means practically: your post-meal blood sugar spike is dramatically reduced when you move after eating, even gently, even just a short walk around the house or the block. And a lower post-meal spike means less glucose arriving at the liver. Less glucose arriving at the liver means less de novo lipogenesis. Less fat production means less hepatic insulin resistance over time. A randomized controlled trial published in Diabetologia showed that a 10-minute walk after each meal reduced post-meal glucose more effectively than a single 30-minute walk once per day. The timing matters more than the duration. Step 6. Monitor the right labs and know what to ask your doctor. Most seniors with blood sugar concerns have their fasting glucose and HbA1c checked. These are important, but if you want to understand what your liver is doing, you need to ask specifically for the following: ALT and AST, liver enzymes. Elevated levels indicate liver cell stress. Mildly elevated ALT is one of the earliest signals of fatty liver disease, often appearing years before any imaging would detect a problem. Fasting insulin, not just fasting glucose. Your fasting glucose can appear normal while your insulin is significantly elevated, a pattern called hyperinsulinemia, which indicates insulin resistance is already present. Many doctors do not routinely check fasting insulin. Ask for it specifically. Triglycerides directly reflects hepatic de novo lipogenesis activity. If your triglycerides are elevated, your liver is actively converting excess glucose or fructose into fat. A triglyceride level above 150 milligrams per deciliter, particularly in the fasting state, is a clear signal. Uric acid. Elevated uric acid is produced as a byproduct of fructose metabolism in the liver and is itself a driver of hepatic insulin resistance. It is also strongly associated with cardiovascular risk. Checking it is simple and inexpensive. Write these down. Bring this list to your next appointment. These 4 labs, ALT, fasting insulin, triglycerides, uric acid, tell a story about your liver's metabolic state that fasting glucose alone cannot tell. Comment below right now with this. Labs requested. If you are going to ask your doctor for these 4 labs at your next appointment, I want to see how many people are going to take this step. I want to spend a few minutes on something that most blood sugar content never addresses: the connection between the liver, the brain, and cognitive decline in seniors. This is not a small footnote. This is one of the most important and most underreported aspects of metabolic disease in older adults. When the liver is producing excess glucose overnight, when hepatic glucose output is dysregulated, the blood sugar fluctuations that result don't stay in the bloodstream. They reach the brain. And the brain is exquisitely sensitive to glucose variability. Research published in the journal Neurology has found that glycemic variability, not just average blood sugar, but the swings and spikes in blood sugar throughout the day, is independently associated with accelerated cognitive decline in older adults. The brain, which depends on a steady fuel supply, does not handle blood sugar chaos well. Furthermore, the same inflammatory cytokines that a stressed, fatty liver releases into the bloodstream, the ones that worsen insulin resistance throughout the body, also cross the blood-brain barrier and promote neuroinflammation. There is growing research suggesting that what we call metabolic disease and what we call neurodegenerative disease are not separate problems with separate causes. They share a common inflammatory driver. This is why blood sugar management for seniors is not just about preventing dialysis or avoiding amputation. It is about protecting your mind, your memory, your independence. The kidneys deserve equal attention. Your kidneys filter your blood constantly, approximately 200 liters per day. When blood sugar is chronically elevated, glucose molecules attach to proteins in the tiny blood vessels of the kidneys in a process called glycation. This damages the filtration units, the nephrons, progressively and silently. The kidneys compensate for years before kidney function on a standard lab test begins to decline. By the time GFR, glomerular filtration rate, drops visibly on your labs, meaningful damage has already occurred. This is why acting early matters enormously. The liver changes I've described, the fatty liver, the hepatic insulin resistance, the unchecked glucose production, these are early-stage, reversible processes if addressed appropriately. Kidney damage, once it progresses to a certain point, is not reversible. And here's the part that gives me the most hope to share with you. Research has repeatedly confirmed that even modest interventions, not dramatic, not extreme, can meaningfully reduce liver fat and improve hepatic insulin sensitivity within weeks. A study published in the American Journal of Clinical Nutrition demonstrated that just 7 days of reduced fructose intake produced measurable reductions in liver fat. 7 days, not 7 months, not 7 years. Your liver retains a capacity for regeneration and repair that few other organs match. Given the right conditions, reduced fructose, adequate protein, consistent eating windows, post-meal movement, it begins to recover faster than most people expect. Let me bring everything together for you. Your blood sugar problem is not just about carbohydrates and insulin. At its core, it is about your liver. A liver that has become overwhelmed with excess glucose, has started storing fat it cannot use, has become resistant to insulin's instructions, and has begun releasing glucose into your blood on its own schedule, regardless of what you eat. But this is not a death sentence. It is a process, a biological process with clear, documented mechanisms. And that means it has clear, documented points of intervention. You now understand those intervention points better than most people who have been managing blood sugar for years. Here is what I want you to do right now, before you close this video. First, subscribe to this channel. Not because I'm asking for engagement metrics, but because this content takes weeks of research to produce correctly. If YouTube doesn't see that this video is reaching people who need it, the algorithm buries it. The next senior with a fasting glucose of 180 and no one explaining why won't find this explanation. Your subscription keeps this information visible. Second, leave a comment. Tell me one thing from this video that your doctor has never explained to you. Not to help me, to help the person who scrolls past this video wondering if it's worth watching. Your comment is a signal to them that this is real. This is different, and this is worth their time. Third, share this video. Think of one person in your life, a spouse, a sibling, a close friend, who has been struggling with blood sugar for years and feels like they're doing everything right, but nothing is working. Send them this. The missing piece is usually the liver, and now they'll have the explanation. And finally, the Blood Sugar Toolkit. We created this resource because a 30-minute video, as detailed as it is, cannot hand you a complete daily system. Just like Dr. Roy told you earlier, the toolkit includes the complete blood sugar guide with doctor communication scripts so you can walk into your next appointment informed and prepared. It includes the cookbook with 40 low glycemic recipes and the plate method. It includes the herbal tea guide, cinnamon, ginger, hibiscus, and 7 more with genuine research behind them. And it includes the full 30-day program, daily plans, tracking tools, senior-safe movement guidance, structured to take everything you've learned today and build it into your life week by week. The link is in the description below and pinned in the first comment. If this video helped you understand something about your own body that you didn't understand before, that resource is where you go next. Your liver has been working for you without complaint for your entire life. It deserves the same care in return. Start today. This is from the Jackson Diabetes Clinic team. I'll see you in the next video.